welcome back to Medical Coding with Blue. Today's episode is all about Performance Improvement Program, or PIP, for medical coding. What happens if you get put on one, what you should do, and how to think forward. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so a PIP. Now, a lot of people will fear a PIP, and PIP is pretty scary, right? Because this says you've got a certain amount of time. Sometimes it's 6 weeks, sometimes it's 2 months, depending on the organization, however long they want to do this. But basically, you're going to go on a probationary period. You have this time, whether it's 6 weeks, whether it's 2 months, to perform better. That's why they call it Performance Improvement Program, okay? Maybe some places they call it something different, but that's generally what the gist of it is, right? And so if you're going on this means that you need to improve, or the consequence is that you get fired, okay? So no one ever wants to get on a PIP, but sometimes when people are starting out, especially in health information and medical coding, a lot of people, this happens because schools really push this. Oh, you'll learn. They'll train you on the job. No, they won't. And so a lot of people are disillusioned when they start and, oh, somebody's going to train me. And then they find out really quickly, hey, no one's going to train me, which is why I always stress on my channel that you guys need to study and make sure that you're studying 20 hours per week. There's no excuse. Everybody has that time. If you got time for TikTok and all these other things on social media, you got time to squeeze in 20 hours per week. Doesn't matter if you're working a full-time job. Doesn't matter if you have kids. You can still listen. You can still work with your workbooks. You can be doing all of that in the meantime, in between time. You can fill those pockets of time when you were wasting that time scrolling on the internet. I'm just saying, whatever is important to you, you will make happen. But this is why I stress all the time on my channel, so that people like this person who is right now, they're panicking. And I understand, because like you're about to lose your job, because a PIP is where they're going to really be taking the microscope to everything that you do. And again, if you're coming in thinking that people are going to hold your hand and really, be right there with you, that's what happens when something like this happens, okay? And now this person just started. So let me read you this and then we'll get into it. The person says, I would like to pick your brain. I graduated from RHIT school with coding. Let me back up for a second here. I don't like the language already. RHIT, Registered Health Information Technician, is the credential that you can get when you have completed an associate's degree in health information technology, right? If you've gone through a CAHIM approved program and you went through the associate's degree program, you can sit for the RHIT. There is no, oh, I got a bachelor's in health information management, can I sit for the RHIT or the RHIA? That is frightening if you do not know the answer to that question, because your school should be telling you that if you have a bachelor's, you sit for the RHIA. If you have the associates, you sit for the RHIT. This person says, I graduated from RHIT school. There is no such thing as RHIT school. That is a credential with the American Health Information Management Association. You completed a Health Information Technology Associate's degree. That's what you completed. So again, it's the detail right there that may be messing this person up. This is what I'm seeing all the time when people come to me panicking because either they've been put on a PIP, or they're being told that they're going too slow or something like that, or they don't know. It's in the language, guys. You need to watch the language. So for going on, I have not taken my RHIT yet. I was hired June 16th, and this past Thursday, I was put on a performance improvement plan. I'm an inpatient coder. In school, we didn't code from medications/conditions. We only coded conditions. I don't know my meds. I need to do 8 surgical/palliative in a day with by September 11th with 95% accuracy. I have watched some of your videos. Do you have any pointers for me? From what I took away today is I'm spending too much time writing down all the conditions. I'm going to print it out tomorrow from the H&P. I'm very stressed that I will end up losing my job. Thank you. And then they came back and wrote another message and says, could you point me to a video that may help me out? I graduated with my associate's degree in HIT. In RHIT, they said. Coding is part of that. I graduated April 16th. June 16th, I got an inpatient coding job. I'm doing palliative and we code all chronic and what is from med list, like STEMIs and such. I was put on a performance plan a week ago. I am having problems. What I should and shouldn't code. Could you point me to some help /video /resources? Thank you. And I said, in my comment, I said, you don't need a video. You need to read your guidelines. It tells you what to pick up and when. They come back and said, I'm supposed to be getting 8 palliative surgeries done in a day. Sometimes I have 2 pages of conditions. I also have problems with SAMIs and things like that, or stroke type stuff, old, new. I have no idea what they were saying there. And I said, I don't know what SAMIs is. And as I said, this is a guidelines issue. If you had read them, it gives you directions on what needs to be picked up and what does not. I know you're overwhelmed, but this is part of your job. If you're not reviewing this at night, when you get home from work, to help yourself, you might as well look for another job. But keep in mind, this is going to keep happening if you're not studying or practicing. It doesn't matter what you learned in the school. What matters is that you're in the real world now, and it's time to start listening to sound advice. Like when I'm telling you this is a guidelines issue. A lot of people will say, well, I don't know what to pick up. I don't know what to pick up. In the guidelines, it tells you that you pick up what is relevant to that encounter. What did the provider have to consider in order to treat that patient? Of course, I'm paraphrasing that. But some facilities have separate rules too, like, hey, if the patient is a smoker, we always pick up the smoking, okay? Because they like to run their own little reports, their own data reports. So if that's the case, then that's what you need to do. But you saying right away, well, I don't know my meds, that's a simple Google search. If you don't know what a particular med is, you can Google search that. And the commercial for it will pop up most likely. But that's when you need to look in your book. The Optum book has an entire appendix. The ICD-10-CM, Expert for Physicians, has an entire appendix about the meds in the back. So you could be looking that up. Now, let's just say, for example, the patient has diabetes, okay, and they are on insulin. Well, would it make sense that when you are there, the provider documents, the plan of care and everything, they also have to think of how much, and what's going on with this patient's insulin. Are they stable on this insulin? Is everything going okay? Are they going to continue it? This is part of it. And if you look in your book, again, when you look up diabetes, it will tell you, hey, if code also the insulin, if it's there, if it's documented. So this stuff is not hard once you start looking at your book. But right now, if you're panicking because this is happening to you and it's so overwhelming, there's so much. This is what I tell people when really stressful situations start to happen. We need to stop. We need to stop. We need to think, okay, what is the end goal here? What do we need to do? In this lady's case, I would like to keep my job. Okay, what is it going to take for me to keep my job? Okay, well, if I keep messing up on, oh, I'm missing this medication, I'm missing that medication. If I know medications are a problem for me, I am going to take my book with me. And I'm going to use my book every time I see something. While you're writing stuff down, I have no idea. You should not be writing anything down. That is taking your time away. So again, if you're looking at the note, you should be able to look at the note and enter in the code. And again, you have your book with you so that way you can look stuff up. Now, if there's something that you know, hey, I need to look up this, what is this med, and then you can Google that. You can do that. But again, when we're not reading the coding guidelines, we're going to feel rudderless, like we don't know where to go, because the guidelines are going to tell you in specifics what to do. And it is literally broken down by chapter. So there's a whole Z codes chapter, right? There's a whole Z codes chapter, and it's going to tell you all the things that you should know about reporting Z codes, and when is it relevant and when is it applicable. If a patient is coming in and they have the flu, let's just say they have the flu, right? They have the flu, and the doctor says the patient is a 35-year-old male coming in with the flu, and the patient has post-traumatic osteoarthritis, and they're on meloxicam. The patient started coughing and has not been able to stop coughing. Nothing is relieving the cough. Patient has tried over the counter, blah, 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 all these things. And at the assessment and plan, they say, okay, well, x-rays show that the patient has the flu and all this other good stuff, right? There's fluid on the lungs and, things like that. Maybe the patient has pneumonia now too, right? Not an x-ray for the flu, like the swab for the flu. Sorry. I'm trying to do this really quickly because in 9 minutes I have an appointment. So they did a swab for the flu. They tested positive for the flu. They did an x-ray and it's showing fluid, so they on the lungs, and they probably have pneumonia as well. So are we going to pick up anything about that meloxicam for the patient's post-traumatic osteoarthritis? No. Did the provider have to consider the patient's osteoarthritis because they're treating the flu and possibly pneumonia as well? No. So that's what we need to consider. We need to look at. Not everything that you see listed is going to be picked up, because we need to have all of the information, or the provider rather needs to have all of the information, so that they can take into consideration all of these things. And maybe if the patient is saying, hey, I have this condition and I also have this condition, something's going to click in the provider's head. Hey, they have these other two risk factors, so now I've got to consider these. And when they're documenting and they say, well, I looked at the labs for, maybe because they have I don't know, now I'm trying to think really quickly, but they're looking at their PTT scores, right? Their prolonged thrombin time, right? They're looking at their clotting, right? Because they're on anticoagulants, okay? Okay, now what are we doing there? We're assessing this patient now because they have this other condition as well, and they're on this anticoagulant. Now, okay, because we checked out the lab for that to make sure that their clotting is not out of control, that would be picked up. And if they were on, I can't really say medication names, okay? But just know that there's anticoagulants out there. If I say a particular anticoagulant and then you say, okay, well, that would be picked up. There's literally no excuse for not knowing your medications. Medications are very easy. And as I said, if you have the Optum ICD-10 CM Expert for Physicians in the back in the appendixes, I believe it's in Appendix A or Appendix B, two of them, they cover the meds and they cover what the code is for the long-term use, okay? But when the med is related to that condition, and that's what they take, and they're saying that it's okay, that it's stable, they're stable on this medication, naturally you can pick it up, because this is just more informational. And you're not going to sit there and go through everything and pick up everything if it's not relevant to what's going on. In example, the case that I said, the patient with the flu, and they're on meloxicam. Who cares? That has nothing to do with the flu. Nothing absolutely at all to do with the flu. Okay, and possibly pneumonia. Nothing to do with it at all. But that's the thing. And take this seriously, So it's not going to do you any good to keep panicking. We already know that our end goal is to keep our job. So let's get our resources together, and whether that is going into Google after work, when you get home and you start looking up these medications that you say, okay, I don't know this, Maybe you're working in a pulmonary clinic. You can go to the American Lung Association. You can start reading all about lung conditions, right? And then sometimes you'll see what kind of medications they're on as well. The Merck manual online, I have recommended that umpteen times. And that will also tell you about conditions and what kind of meds they get put on and things like that. So those are the things that you could be doing for yourself to help yourself. Because running around in circles and being panicked because you're about to lose your job, what is that doing for you? Nothing, but making you even more anxious. So let's focus. What is the end goal? Let's keep our job. Okay, so when we get to work, we need to put all distractions away. No telephone. We do need to be taking our breaks. Okay, people, a lot of times they have their 15-minute breaks. I get 2 15-minute breaks in a day, and I take them. You have to, because you have to give your eyes rest. Otherwise, you can get eye fatigue. You know, you have to get up and move around and stretch and walk and things like that so that you're not sitting there and you're not going to get burned out. You need that time. So minimize the distractions. No cell phone, because I've seen people do that too. I can't keep up with my productivity because you're right there on the phone with the phone in your face. The next thing is to take your breaks. The next thing is to make sure that you're sleeping at night. You need to sleep at night. A minimum of 7 hours. That's the best right there. And you can get that. Get those 7 hours because your body needs rest, because right now you're under stress. So get that rest in. Prioritize that, because you want to keep your job. You're going to prioritize your health. Get that study time in. And whether it is like, oh, Blue, I don't understand about this, and I don't understand that. I really don't understand what some of the things that they were saying there were. But you know, if you go to Crash Course on YouTube, Crash Course Anatomy and Physiology, you'll see all those videos pop up, and they'll start to explain all about those conditions and things like that. When you are struggling with what to pick up and when, you need to start learning what the language is. That means that you're going to start working with videos like that so that you can start learning. And you can be doing that in your off time. So that way you can be better, and you can say, okay, well, if I work in ortho, I can go to orthoinfo.org and I can look up all of the conditions that I'm confused about. I'm confused about rotator cuff tears. I'm confused about meniscus tears. I'm confused about what osteoarthritis is, because believe it or not, there's people that don't know what that is either. So you do that. So that way you can ready yourself and be prepared. Okay? But stop beating yourself up because, oh, they didn't teach me this in school. School is gone, my love. School is gone. You need to work on yourself. You need to prepare yourself. And at the end of the day, if they say at the end you didn't make it, let's just say you got 93%. So they say, we're sorry, we're going to have to let you go. You be gracious to them. You thank them for their help, their support, their coaching. You really appreciate that. You get yourself back home and you dry your tears, because you will cry. You get your resume together and you get right back out there. Do not let this one place that they let you go because you couldn't pass a PIP, do not let that take your dream of continuing on in this career field, because it is for you. You were brought to it for a reason, but you need to get it in gear and start studying, okay? Because that's the only way you're going to be able to make it out of this. That's the only way you're going to be able to make it out of it. And if you get stuck, you need to go on LinkedIn, ask for a mentor. Somebody, I need somebody to help me, and I need a mentor. A mentor will help you for free. Now, if you want to pay somebody for their time, that's a good investment, but make sure that you get a good tutor. If you tell somebody, hey, on LinkedIn, I'm looking for a tutor recommendation. Does anybody have any tutor recommendations? And then people will let you know. People will let you know. I'm a tutor myself. My rating contact is in the description box below. And with that said, I got to go. So I will see y'all next time. Bye.